Just want to bring in my good friend on this Thanksgiving Eve. Wish him and his extended family a happy holiday. And that's my good friend, Dr. Joe Congini. And Joe, thanks for certainly coming on with us again this morning. Goodwill to all of your family. I imagine you'll be gathering with them. But what do you have for us this morning, my friend?
Hey, thanks, Ray. Thanks for everything this year. And, again, coming off last year, another tough year, but a lot to be thankful for us. And I want to wish the same to you and yours and all the great things you do around the community and with your family, and I know how important to you. So enjoy a little bit of downtime and a little reflection on all there is to be thankful for with your family, Ray. Have a great Thanksgiving.
Thank you, my friend.
One of the problems that I've been seeing the last few weeks, and it's so often mistreated that I just wanted to mention it briefly today, is an injury that occurs, again, in young athletes. And so young athletes are not the same as adult athletes, but this is I talk a lot about growth plate problems. This is a problem that occurs around the hips and the pelvis, and they are the last growth plates that would be open. And so people really get confused about this one because this growth plate fracture occurs a lot in kids that are 7th, 8th, 9th, 10th graders, even sophomores still get this problem. And a lot of parents and coaches just really don't understand and think for sure that it's a pulled groin muscle, a hamstring strain or a hamstring tear. And so very often they will get a few days of treatment and rushed back out to try to return to play. And this injury takes a full month to heal. It heals very well when we diagnose it, but it is what's called an avulsion fracture of the growth plate. It's a pull-off fracture, and it's because the muscle still is stronger than the growth plate up in the hips, in the pelvis. And very commonly it is hamstring and groin muscles. And it is confounding to the athlete and to their coaches and others because, hey, this soft tissue injury should be getting better. Kids almost always feel a pop, and they're really limping around. They cannot run at all, and they feel a little better. There's a little healing in 3 or 4 or 5 days, maybe a week, and they go right back and they injure it again. And by the time we see them, it might be the 3rd or 4th time they've tried to return. And by then, they may have some weakness developing. They may have a lot of bone laid down trying to heal the thing, and the kids aren't allowing it to heal. So, again, we talk about things that are unique in the younger athlete. But this isn't the real young kids like Osgood Schlatters, which is, ages 8 to 12, or Little League Elbow, which is in that age range. This is 12 to 15-year-old kids. And so I just want people to have a heads up. When this injury occurs, they feel a pop, they're limping around. You might want to get them into somebody who takes care of kids and treat that appropriately because they'll do great if they get appropriate treatment and they really sit out for a month and rehab for a month. They'll do great. But if we keep trying to rush them back every week, this ends up being a problem. And by the time they're treated in our office, it's a lot harder to treat. So I just wanted people to be aware of this. It doesn't have any cool name like Osgood Schlatters or Little League Elbow, but it is in the younger, still growing high school kids, is a pull-off fracture around the hip or pelvis.
Dr. Joe Congini with us, Sports Medicine Center, Akron Children's Hospital. And Joe, gigantic sports fan, as many of you know. Joe, Baker Mayfield coming under the gun a little bit. And, you look at his performance probably a little bit different. He's got a bad ankle, bad knee, fracture in the left shoulder, and a torn labrum in the left shoulder, still out there chucking the ball around. We saw his accuracy off last week, and I thought maybe you could reflect from a medical standpoint, because some people will say, well, he doesn't have an injury to that right shoulder. He should be still able to get it there, but all those things go together to make an NFL quarterback, and when they're all not working together or some bruised up and banged up, what you get sometimes are some inaccuracies.
They do, and I know I've had this talk with you, and again, you're so good at understanding and knowing these things, and you and I have talked about it with Cleveland sport athletes in the past. It seems to get to be kind of a cumulative effect injury, and other areas, when you're trying to protect one area, become at risk. and we definitely do see this in our high school athletes too, is when they are trying to play through one injury, they very often will be at risk for injury to other parts of the body. And as it starts to get to be on a cumulative kind of roll of these injuries occurring, it really can be hard to play the games. And so I know it really hurts me. And again, I don't know the details. I'm very much in contact very much with the coaches in town and the coaches particularly for the teams that I take care of, and try to give them a little bit of input on a few of these injuries too. But I did hear in a press conference this week, the word they used was cleared to play and continue on. But it was really painful to watch this young man. I think he wants so badly for the team, his teammates, the city. I think he gets how this team is so desperately wants to move on to the playoffs, and he probably gives them the best chance, and so he's trying to play through that. But I definitely do think, and I'm sure in this case that's what's happening, is the medical team can have a lot of input. So the athletic trainers who know him well and the team doctors, I'm sure, are giving some input. And, of course, at the professional level, it is a different game than at the high school level. But very often there has to be some point where we say, gosh, we're heading down a bad road here with cumulative injuries. I mean, I think you and I can remember talking all the way back to Grady Sizemore and others that, one injury starts and then it really starts to be kind of a snowball effect, and it's really hard. And also, even with all my years on the sidelines and in sports medicine, it is really hard for me to look at a guy and say, how much is that injury in the heel affecting? But it surely looked on Sunday like it was affecting. And you just hope that, I guess, the way football is, it's a week of recovery. And they keep mentioning that he's had some really good physical therapy treatment during the week, that he can get well because he wants so desperately to be helpful. And yet, on the other hand, as you said, the snowball effect of these injuries really seem to be taking a toll on his performance as well. So the point is, I think good communication between the sports medicine team and the coaching staff is critical to make good decisions for your players on the field.
Great stuff this morning, Joe. Have a great holiday, my friend. We'll reconnect next week.
Thanks. We'll talk next week. Thanks, Ray. Have a great Thanksgiving.
You as well. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with us this morning, 93.5, 1590 WAKR.